Your cat tried to put his asshole tongue on my nose. I'm back, everyone.
Where's my... Oh, I don't have a cursor for this.
I have a beard. You can't see it.
So I don't need to watch that?
No, that was the prologue. We already watched that.
I don't remember. It's been a long time.
Look, butterflies flew away from a sleeping girl.
That's how we like them, sleeping. Listen, you want to get your rest. Oh no, the light's reflecting. I gotta turn it off.
All right.
Stop it. They're gonna know.
Dr. Cunningham, this patient's convulsing.
Wake up, lazy bones.
Damn it. Just never ends.
You're ready to get your house on?
Every time I take a nap in the middle of my shift, people always yell at me.
Can those idiots take a break from dying for like 5 minutes so I can catch a snooze cruise?
Those are some pants.
Those are some boss-ass shoes.
Looks like a jumpsuit.
Those are some boss gators, dog.
Oh.
Must have dozed off with a cigarette in my mouth.
Oh my god. He did, though.
Yeah. For safety's sake, you know? Oh, there's his jerkin tissues.
Oh my... Nepia.
Nepia.
I thought it'd be useless calling the house.
It is useless calling the house.
I want to get Joshua's things next Sunday.
Oh no!
I'm sure you won't be there anyhow.
She said anyhow instead of anyway.
Mailbox.
She must be edgy, like those internet gaming critics who use both of their middle fingers when they don't like something.
That's really... Then you know that they don't just dislike it, they rather dislike it.
Yeah. Whoa, this guy means business. He said fuck 3 times in 1 sentence.
That's a lot of fucks that he doesn't give.
He just said poopy ass dicks. Hardcore.
Chapter 1, getting divorced. Chapter 2, signs of anguish.
Chapter 3, custody hearings.
I would love a game that covers like weird
Oh god,
day-to-day things
Phoenix
like that.
Wright, divorce attorney.
I'm coming in.
I'm naked.
No,
I'm not naked.
Phoenix Wright, divorce advocate.
Heavy.
Oh, it's the cute nurses
What's going on?
who flirt with each other all the time.
All the time, they're gonna have babies.
They're gonna have babbies.
They're gonna have mad babbies. Trauma Team 2, mad
Bad
babbies.
babbies.
You to your new partner.
Angry babbies.
The Roni system,
Yep.
or is it Ronnie?
Roni.
Like Roni
your
would be the
diagnosis
Japanese, but
system.
remember in Trauma Team they're magically American then.
Yeah.
Signs of anguish.
Roni, you know, like the pasta.
Angie. Wait, no,
My office
Anguish.
isn't a storage room.
This baby's built to help.
I mean, it is a storage room, but only for my cigarettes.
Here, we noticed you weren't very good at your job, so we gave you a WebMD robot.
He just pulls out the drawer. There's just mad amounts of cigarettes.
God, there was a nurse at my one of the nurse practitioners at the at Emporia State, the university I went to. She was not very good at her job.
Oh?
Literally, it's like I was like, wow, Trauma Team made this look way cooler than it was. Basically, what she did was like she asked me what was wrong, and she had like an iPhone that she was browsing WebMD on.
Oh, that's WebMD in particular is not great.
Yeah.
I don't know,
It's
just
like, great, I get to know about the foot cancer I have. It's like, lady, I have an ingrown toenail. I just want to know what the best course of action
I
is.
know what it is. Advise me.
It's like, whatever your advice is, I'm going to pop it, first of all. It's going to happen.
Popping it. The only question is, where do I pop it? Is it here in your stupid face or not?
Because let's face it, if there's ever anything on your body that can be popped, it's always immensely satisfying to pop
He's got
it.
fucking cardiac neurosis. He's got a tired Kokoro.
I like how the robot jumps to that and not the cigarette hanging out of his mouth.
He was like, yeah.
Thanks for the tip.
I like it. She's like, you are slightly tired. Do I have cancer? No? Oh, I can keep smoking then.
What's your request?
Just don't talk anymore unless I ask you to, okay? Just sit there like a rock. You got it?
Travis Willingham.
I don't think computers understand similes and metaphors.
But my composition is 82%.
They don't, see?
Oh no!
You
it
were
read
right.
my mind.
He's just like, the shit I put up with.
He's doing half a JoJo pose there.
Yep.
If his other hand was on his hip like this, and then he was about to fight someone with no clothes on, that'd be JoJo. I like saying it like JoJo.
Oh, well, it's a good time to spoil that last chapter that's locked. It's all naked fights.
I want
Yes!
to use you.
You gotta work for the Maria Torres chapter, though.
Wait, you just missed an uncomfortable part where he was looking at a 14-year-old girl's profile and he asked, so how do I use
James,
you?
this is not the most uncomfortable thing that's gonna happen to that 14-year-old girl in this chapter. Get ready for stethoscope time.
Ooh, it's
You got any Dr. Pepper?
It's a little cold. I have Dr. Thunder?
I'm okay with that.
Yeah, would you grab me one too?
Yeah.
There's a 90% probability that you're human.
Get back to me on that 10% now.
Is the other 10% douche?
The other 10% is cigarette.
Wow, that is a lot of cigarette if you are 1/10 cigarette. Like, those things are like 2 grams.
No, Cunningham's actually only like 10 inches tall, is the thing.
That's true. Dude, look at her fucking hands. She's on the mad-ass chronic.
Dank-Ass chronic. It's some
No,
dank
she's not
chronic.
progressed up to there. Look, she's a
not.
high school student. She can't afford the Dank-Ass chronic.
Well then,
God, Jim.
ready, Miss?
Learn the lore.
The lore of trauma. The lore of trauma team, and it all revolves around marijuana dispensaries.
Diagnostics.
Alright.
She ate way too much of those chocolate yum-yums.
Point to the options on the left. Press A to begin the examination. Let's ask this woman
What you got to say?
Okay, yes.
some questions. Point at words related to their symptoms and press A. I'm the school choir. First symptom.
First symptom, nerd!
Is this an abnormality? No.
There's an important competition coming up soon, but my
Oh, her throat feels all weird. Whoa, look at her fucking throat.
Does it have something to do with how your dad's apparently beating you?
Oh my god.
We need something more specific than that.
It's an abnormality. Oh, so I need
We need more specific information. That's a symptom!
It's kind of hard to
She
inhale.
can't breathe, bro.
Can't breathe worth a shit like a fucking scrub.
Trouble breathing.
A light case of dyspnea.
Like he's a dyspnea. Bet you can't even count frames, Roni.
Congratulations. You received the symptom. Dyspnea.
I don't want that.
Make it sound like we're playing a video game or something.
God damn it, Nisa!
That is the default.
Do you get it, James? Because they're in a video game.
Oh my god.
Because they're in a video game, you
Hey,
see.
Jim, laser eyes, demon eyes.
Oh, all we need next is for them to
I have a variety.
all we need next is for them to say this is like something out of some kind of anime.
That'll do.
Okay, so we've changed the context to be slightly less derpy.
Slightly less trivializing of our patient's needs, slightly less ableist.
actually, I had to take the day off from school yesterday.
Oh, that's important. No, it's
No
not.
abnormality there.
Oh
I skip all the
no!
time.
I'm 1/5 dead!
To my breath.
Okay, she's getting short of breath.
If you get her symptom wrong, she fucking stabs you.
So you've got palpitations and shortness of breath.
And if you mess up 5 times, the alien comes out of the vents and kills you.
I'll need to osculate you later on.
Dude, is he hitting on her? He just told her he'd osculate her later.
Yeah, you play as Illa Guardiola in this.
Oh, god damn it.
Too soon?
Sorry.
No.
How long ago was that?
No. She's 14. Illa Guardiola would wait a couple years.
I've never been able to stick to a diet before, but lately I've been able
Oh,
to
she's losing mad weight. I feel like that's probably not great.
Lost weight. That bitch. I've been dieting for months and I haven't lost any weight.
Even though I'm smoking mad
I've been
chronic.
watching my figures.
I've been smoking mad chronic and only eating cigarettes.
I've eaten nothing but cigarettes and trail mix for the past 4 months.
I've only been eating cigarettes and smoking trail mix.
Yikes, what am I talking about?
They told me to stop smoking with cigarettes. Instead, I eat the cigarettes. And I smoke the oatmeal.
Alright, I think I got everything. Please shut the fuck up.
Alright. Are you ready to get arrested?
Stethoscope.
right.
Stethoscope.
Take a listen.
Lift up your clothing for stethoscope.
Oh,
This just got very Japanese.
a little embarrassing.
Doctor, please express more consideration when examining patients of the office.
Especially when they're 14 years old. You pedo trash.
Is it awkward that I'm pointing my Dr. Laser at her boobie?
Socialized legal interest.
I should do that when I get a laser pointer. See in this general area right here.
Somewhere around the just a general tits area. Like really unscientific, undoctory terms.
I wish I could do like the Ace Ventura thing where I could like mess around with like like shadow puppets on someone's nipples and they cross their arms. Hi-ho, Silva, away!
The social and legal intricacies in such interactions call for greater care to avoid unnecessary risk.
Yeah, I get it. Just lift up your shirt, okay?
Need to examine her.
Oh, I'll be alright.
Oh, look. You just made this whole deal even
Yeah, look how much she's like freaking out here with her skeleton hands. I'm just gonna use the stethoscope, okay? Everyone who's masturbating, stop.
Stop!
Stop right now.
Everyone who's masturbating, your grandma is very disappointed in you. I want you to think of your grandma right now.
Okay, so this is normal noise, and this is the noise there.
Yeah, maybe we should be quiet for this. Oops. Maybe I should shut the fuck up.
Alright, so Bella...
You can switch it over to be on the TV instead so that the audience can hear it. Yeah, like that.
Okay.
That's different.
It's different.
Look at those peaks, dude. Duh.
How do I point out that it's different?
You just you switch back to the yellow view, and then you just hit A, I think. Yep.
Patient's breathing pretty rapidly. Roni, make a note of it.
Is something wrong, doctor? Yeah, you need to get a spit filter. You are peaking bad.
God, fucking amateur. Let's go right here in the
Scrub.
heart. So heart seems to be a little fast. She's scared of me.
Her heart rate is elevated. I don't know why. They're usually so calm when a man 20 years older than them touches at their chest.
Yes, doctor. New symptom observed. Terrified of doctor. Tachycardia.
That means the heartbeat's going faster.
That means she's got a tachyheart. Okay, there's...
Bradycardia is when it goes slower.
I just want to point out that there are 4 indications here. One...
Yeah, but those two lungs are the same. No.
Those are lungs.
There's 2 lungs, yeah. I almost said they're lungs. They're both lungs are the same thing, but not necessarily.
So, normal is this.
Yep. If you already got the same pattern on that one, then you're good. It's the same symptom. Yeah.
I've already confirmed this.
Yeah.
I thought I didn't...
And then tummy is the last one.
But I already did tummy.
Oh, somebody had toast this morning. Did you eat cereal? I know you ate cereal.
He just starts pounding on it. I smell cereal! Is this the same? I can't tell.
Yeah, it's the same, I think.
Okay. So am I done? Because I confirmed that her breathing and her heart rate is high. I don't know what else there is.
We're done here. How's her hands?
You're placing the stethoscope in the wrong area.
You can take a pulse from the hand, Roni. Quit riding me.
I've already confirmed this symptom.
Well,
You're placing it in the wrong area. Wait. They just gave me a prompt. Heart, lungs, and abdomen.
yeah, you've checked everything.
Did I just exit them?
Yep.
Okay. Sorry for unnecessarily prodding you. I didn't know what I was fucking doing.
The more I examine the patient, the more incongruities I'm finding.
Can you stare at the light? She's not staring at the light. She's blind.
It's AIDS.
I'm sorry.
She's not staring at the light. It's AIDS. It's like, did I win?
I'm sorry to let you know you have goddess of herbal AIDS. What have you been doing?
Well, it's those choir nerds. They don't know how to have.
And then the machine's like, Doctor, goddess of herbal AIDS is not a medical condition in my book. Don't tell her how to live her life. All right, I've already questioned her and I've already stethoscoped her. So
You can zoom in on her.
Yeah, I'm gonna look at your like fucked up neck, Dad. That's
Now you can listen to all his creepy comments whenever you examine patients like
There
this.
appears to be swelling on her neck.
All right. I'm sorry, but I need to touch it just a little.
It's not the first time he said that.
Yeah.
Oh, yes. Please do so.
Oh,
I see. Does this hurt?
oh, this is getting
It
awkward.
does hurt a little.
Mm.
I think we should do a CT scan.
Yes, doctor.
Understood, doctor. Entering system. Domestic abuse.
God damn it.
What? It's for today. Immediately, right now.
If I could continue to endear myself to the
Are you aware of hospital regulations? No.
No one ever got better by following regulations.
That's not
always
necessarily
true.
true.
Observed.
Swollen neck. CT exam is now
I can do
available.
that.
There might be other things to check here. Zoom out. Zoom in on her thighs. Okay, ask her to move her hands.
God damn it. Yeah, her hands are like fucking fidgeting
See,
around.
I was being gross, but I was actually pointing to a symptom.
I saw this. I've noted it like 80 times. Trembling fingers, nervous of pedophile in room. I guess I'm done with all that, so...
Don't thank me just yet.
Don't thank me just yet. I haven't even gotten proper started.
You may have to come back here.
I haven't even diagnosed you if you're proper fucked or not.
Oh, yes, of course. I'll do just that.
Now, time to leave the exam room.
I have some good news. You're probably not going to die.
You probably don't have AIDS, however you are blind. Doctor, your eyes are blue. Lucky guess. Alright.
I'm not an
Wait,
intern.
I'm leaving her in the examination room, but
Yeah.
I'm going to the office to scan a CT.
She's already been scanned. We took care of it.
But no, I had to schedule
We scanned, James, we scanned them in advance.
I had to schedule it though.
We schedule it in the past. Roni is a time machine.
Thanks for giving me a tour of my office, Roni.
Understood, Doctor.
I can also save and talk and door.
Show me the likely condition.
Yes, Doctor.
Where is Dank-Ass chronic?
Where is marijuana?
So, do I drag
So,
these? I forget. how
yeah,
this
you
is-
if you click on if you get a miss, it counts as a miss. So
Yeah.
you got to read these. When you find a symptom, you click and drag it in.
All right. Anemia condition.
Anemia.
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 I'm smart. Insufficient
It's an iron deficiency.
Insufficient red blood cell supply. Iron deficiency. Lack of energy.
Disease originated in South America.
All right. So this is lack of energy, increased heart rate, low blood flow, rapid breathing, and difficulty breathing. Most
yeah.
of the same, but she didn't talk about lack of
Yeah,
energy.
so just try it out. So we saw that, so scroll down, you see the increased heart rate, so you click tachycardia, and you just click and drag it over to the window there. And then if it matches, you get a little thing.
It doesn't match the
If it doesn't match, you lose a life, I think.
forget what tech.
Rapid breathing, tachypnea. Tachy means faster, pretty much.
It doesn't,
Difficulty breathing, which is dyspnea.
so it covers some of those, but it doesn't cover
But not
the
enough
rest.
of them.
So now I just need to press B.
Yep. So the goal is to try and find one that matches up the best.
Alcoholism. I'm gonna go ahead and skip that. Hyperventilation. Trembling hands. Increased heart rate.
She's probably just nervous for her nerd contest with the singing group.
Difficulty breathing was
It's like,
dyspnea.
yeah, we get it. You
This one,
join.
right?
Yeah, difficulty breathing is dyspnea. Yeah, we get it. Glee was popular in like 2010, and you wanted to sing in the choir.
It doesn't cover the other two.
So something else must be at play.
It's not alcoholism, is it? No.
Doctor, she's a teenager. Teenagers are fucking trash.
I like the idea that the computer is super biased against teenagers. Fine. Trembling of the fingers. I'll play your fucking game, you piece of shit. Tachycardia. Headaches.
Why are you so super against her having alcoholism, as if that's the offensive part of this episode?
None of these seem to match, so how do I be like, no?
Oh, we must need more information.
I need more information from this bullshit. I don't have enough symptoms. Oh, I need to go to the analysis lab.
This is the hard part, actually. Some of these are legitimately hard.
Not the first one.
Some of the scans later on, some of the scans get really subtle.
Alright, let's go to the computer and look at her images.
This computer's so powerful, I could download terabytes of porn onto this thing.
No, petabytes. Alright.
I could look up petabytes of regular vanilla porn on this.
I like that. Yeah.
Regular, normal people porn.
I like the idea that he confesses to porn.
I can go to DeviantArtPornPlace.com and get normal non-bicycle pump porn.
Non-bicycle.
Non-sonic balloon porn.
Alright, tilt up and down to compare with a normal sample.
Can I ask a question? Why? Why is inflation a fetish? That doesn't seem like a thing.
Inflation? Like that
Never
money's
heard
not
of
worth
this.
as much?
No. I jerk off to that nightly. I can understand that.
Hang on. Listen, I'm trying to save some.
Like, I listen to CNBC and Fox Business and just be like,
Am I right in saying that these are the same shit?
Let me see here.
This is hers.
Okay.
This is normal.
One more. Hers? Normal. Yeah, move up a layer.
Now,
There's a difference there.
oh, her shit got kicked in.
You see it?
It's right there, right?
Other side. You want the other side.
I knew that. I'm a good doctor. Portion of her thyroid gland is swollen as dick. It must be from all that mad dick she's been sucking.
Oh God, she's 14.
I'm not doing it. I'm not committing the crime.
She's pretty your age, James. How dare you?
Yeah, how dare me. Speaking of which, how's your
Pretty Cure is a wholesome and innocent institution, except for
Speaking of which, how's your Pretty Cure download going?
Alright, I got the first section.
It's
not... James, I'm buying them.
Yeah, that's true. You're buying them with money.
Stop it!
I don't see any other deformity whatevers.
I think that's it for the scans. Possible eye.
So,
Random eye.
return to your office. Go to your office and drink mad amounts of alcohol. The alcoholism was you.
Well then.
Cunningham strolls into the office, an empty 40 in his hand, throws it at the ground by her feet.
Oh, I got new shits.
Yep.
All right.
Now you have all the thyroid conditions.
Let's do the middle one because it's never gonna be the first one. Swelling of the thyroid gland. That thing. Excessive thyroid hormone production. That's not something we know about. Swelling on the neck.
What? She has that!
She has that thing that is right there. In some cases, it places pressure causing difficulty breathing, which is one of these.
Dyspnea.
Fuck.
Gotta scroll down.
Oh, hard gaming, increased heart rate and breath rate.
Yep.
Trembling fingers
and weight loss.
Oh my god, I solved the mystery.
All the symptoms seem applicable to this candidate.
Doctor, it is possible there may be more candidates which match the patient I advised you.
Did I say I was finished with...
Alright, so I gotta double check just to make sure she doesn't have more than one possibility.
Yeah.
How many fucking did... Oh. Let's go with painless thyroiditis.
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 Which is like coitus, but thyroidus.
Thyroid gland swells.
It's throat sex.
Visual swollen
They call it
ass-
thyroidus.
Swollen ass neck. Can't breathe worth a dick. You were waiting for it. Increased heart rate and
Dude, have you figured out what's wrong with you, doctor? You can't breathe worth a dick. You breathe like you got a dick stuck in your throat.
So we did a scan. Guess what we found? Oh god.
God damn it.
God damn it indeed. Alright, so that one also we got a fucking tie here. Plumber's disease, she's got a plumber's dick in her.
Oh god. God damn it.
Swollen.
All aboard the white van candy.
Difficulty breathing.
We're gonna take a nice little night trip to the local prison.
We're just going there for the night though, no big deal.
Yeah.
Listen, if you're not there to stay, they don't get mad at you.
Trembling fingers and weight loss. It looks like just anything that's wrong with the thyroid just happens to do this.
Actually, yeah. Someone in my family got surgery on their thyroid gland, and it affects your weight.
Yep.
Swollen
And like
neck.
the motors a little bit too.
Swollen neck. Swollen neck. Oh my god, there's 3 of them. Oh no. So it's definitely a thyroid. So we can get rid of.
Would you like me to submit immediately for the date and time?
Fuck yeah.
There's swelling on the thyroid gland. There's swelling on the thyroid gland in the CT scan. Minutes later, she probably has a thyroid condition.
So I can just back out of here.
Yep. We need more diagnosis tools. So we got a new tool. We got to go back into the exam room.
Just prod her.
Please proceed.
Poke her with like a stick or a small fork or a large spoon. I don't
Now
know.
it's time for the least interesting part, which is where you look at numbers and you see if the numbers are within a range of numbers.
Good morning, Doctor.
I love math.
It's still morning, you stupid, simple bitch!
Well, We're still narrowing it down.
I mean,
but it's
It's
mostly
a good thing you're a singing nerd, not a math nerd.
I'm
because
going
you would suck dick at it.
Nerd.
Speaking of which,
Like, your nerd puts a cigarette on her forehead. Oh, you got a burn. Rhodey, write that shit down. He said, very douchily.
as if that needs to even be like
Roni.
quantified.
Yes, Doctor.
Of course. Why bother with an exam if we don't look at the results?
He said, very bristly.
Oh god, this looks like fucking dick. I'm saying that a lot. I'm sorry. Look for abnormal levels. This sounds like this sounds boring. Okay, so normal level, measured level. So I'm pointing out the weird ones.
You want to
right?
point out the measured level, the weird ones.
So that's not weird. That's not weird. That's not weird. Not weird.
Not weird.
Not weird. That's fine. Also fine. 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 Sure. Great. Groovy. Yup. Bingo. Yup.
I can't even spell. There is some fun medical facts. If you click on the blood chemical name, you can learn what that is.
I'm not gonna do that.
I like educational stuff like that.
Yeah. We're not here to learn. We're here to make dick jokes.
We're not here to learn. We're here to make jokes about a 14-year-old girl with a dick stuck in her throat.
How did it get here? How did it get there?
How did
Yo, ho, I took a bite of gum gum. I can't find fucking dick about. God damn.
Yeah, I think it's all gonna be in the immune serum. I think.
All right, so not that or that.
Because
yo, her FT3.
Because the thyroid is part of the lymphatic system, I think. So it's probably gonna
Yes,
be
it
part of the
is.
immune levels.
Her FT4 is also a little high.
Yeah.
Just a little high, not as
Yeah.
high. Look how fucking high her FT3 is. That's how doctors speak. Look how fucking high her FT3 is. It's a little bit. Her TSH. Okay, I'm gonna look up what these are. The ones that are fucked up, I wanna know what those are. FT3 is
free triiodothyronine, a hormone secreted by the thyroid gland regulating growth, metabolism, circulatory function. So it must be an iodine.
and FT4 is
Free thyroxine. Yeah.
same thing basically. She's super low on TS.
No, it's not. The other one is like an iodine thing. The other one
Thyroid
is oxide.
stimulating hormone. Secretion of thyroid. Okay, so yeah, that's super goddamn low.
Yeah.
Roni.
It's in like infant levels of lowness.
0.03 when it should be at least 0.3. I think that's everything.
I think so. Yeah.
Yeah.
So let's check our diseases and see what we got.
All right, you hold still. I'm gonna go find out what the fuck you have.
I'm gonna find out how the fuck that dick got in your throat.
I have my measuring tape. All right, so that's gonna be new symptoms or shit, right?
Yeah, it'll tell you what's new.
All right.
We can also use this if we want to narrow down what else we're looking for.
Okay, so low TSH, high. Oh, so it's still gonna be all these.
I think so. Yeah.
Oh, so it might be that. This is gonna narrow down like one of these, basically.
Probably, yeah.
Graves' disease. A high.
Low
wait.
THS.
Oh wait, that's all of these. This
High
is
FT4, high FT3.
God, being a doctor is hard.
Even with WebMD, this is difficult.
Yeah, this is WebMD, not as great a source as originally cited. I need to do a scintigraphy. Scintigraphy.
So we need.
How do I do that?
Yeah.
Oh, you're immediately going to tell me. So I go back to the science room.
I think so, yeah. Because you can use
Back to the
scintigraphy
science
there.
room. This is a long first episode because I didn't realize it was going to take this long.
Yeah.
That's okay.
Fine.
Let's use the image
Yep.
scan. Image scan Meg. Oh, I didn't even look at her MRI. Should I do that?
Oh, let's take a look. These are all new.
Oh,
Because remember the other one.
CT was all we had previously.
Yeah. Because remember those last one symptoms. One of them was that a scintigraphy looks for radioactive uptake. The other one is an MRI. Will confirm something.
All right. So patient.
That's a silly looking picture. Her skull looks dumb.
You're a dumb person.
Look at her dummy head.
Dummy head. That's normal. Nasal cavity normal. Is this the dick?
That's gotta be it.
It's looking a little limp.
It must be uncircumcised.
I didn't need to know that.
Look, it's a different territory. It's Under Siege 2, Dark Territory.
I think these are the same.
I think that's a dead end, yeah.
I just wanted to do my research. This is a very strange thing that we found.
Wait, no. You want to look at the normal one
I know.
first.
I accidentally just
Gotcha.
immediately hit it.
Oh, Oh!
Normal.
Well, there's your dick right there. We did it. We found it.
I want to point
We
out.
found the dick.
I want to point out the small one. Right?
Yeah, maybe. I think either one will work, but... I have still been not able to get a straight answer of what exactly scintigraphy is.
New symptom observed.
It's about...
Normal thought.
Well, it's the study of something.
It's a radiographic technique. They look at like they let you drink like this chemical, this like liquid or something, and the way like the radiation collects in that, or like the chemical collects in certain areas, is different for like a normal thyroid, let's say, or some other part.
Jim, it's obviously the study of skinty.
Yeah, scientia.
All right.
Like that one, like that place in Xenosaga Episode 3, the game I don't have anymore.
Abnormal thyroid uptake. So which of these has abnormal thyroid uptake? So
This has no
not
uptake.
that one.
Yeah.
Get out of here, painless thyroiditis. An MRI scan will show blah, and the entire will show an increase in radioactive iodine uptake.
Yep.
So that.
Yeah, so that's an abnormal update, I think, so yeah. Oh no!
You lied to
The
me,
computer
Jim.
stabbed us!
You stabbed us. Let's go to plumber's disease. In the tumor areas. And this, right?
Yep, I think so. Abnormal update, okay.
Did it. You got
Push
plumber's-
that button, bitch!
Do-do-do-do-do! You are a plumber, and you can never get over it.
Suffering from plump groaning. Contact the
Roni, tell her parents she's been sucking a plumber's dick.
Tell the patient.
Let them know.
Don't
tell her. She doesn't need to carry that weight.
Her parents, however, do, because it's their fault.
It's your fucking fault.
Next time, don't hire a plumber with a 14-year-old girl in the house.
It's just a simple orthopedic procedure.
And
She couldn't possibly resist it. You know, the crescent wrenches,
You need to
the
stop.
P-traps.
You
It's
need
a
to
very sexual profession.
You need to stop.
thank you so much.
Look, it's only because she's voiced by Laura Bailey. Laura Bailey's not 14, you see.
That makes it okay.
Yes.
You know who's also not 14?
Come on in.
Who?
Either of these characters.
Yeah, but he's already in a committed relationship with his cigarette.
Now,
That's true. He's been sucking and blowing them all day long.
I ship Gabe and the cigarettes.
It's my job to watch over everyone in this ward.
all right, just get to the point.
In this ward, they call me the B word from the C ward.
Would it kill you to be sitting
Or is it the C word from the B ward?
Oh God. What is that from?
Arrested Development.
Nice.
went well.
It's a
Joshua's
great show.
operation went hella swell. As in, he's swollen his dick. He's not gonna make it.
Josh Cunningham's operation went great. Who the dick is Josh Cunningham? Why does he have my last name? I'm angry about
What
this.
I'm trying to say is,
Yeah. What else is
Oh
on?
my God, he's so dismissive.
here.
He doesn't look like Chiaki.
An invitation to the ball. What do I look like? A
Good one.
person that goes to one of those balls?
And it's in Japan.
No way.
Yo, it's got an after party.
Yep.
Italian chef.
An Italian chef at a conference in Japan. No way. You remember what
He's
Cinderella...
ripping it up. Oh my God!
Oh man, he's serious. I bet he stuck out both his middle fingers when he tore that up.
How would you even do that? You need those fingers to rip it up.
No, you can just be like...
Oh, by the way,
Can you take this to Hank? A picture of me with my middle fingers?
Surgery instructions?
And see, this is the part. This is the first operation that I did as Hank was operating on her thyroid gland.
Oh,
They
snap.
connect. See.
Oh man, I wonder if there was a way to play this like in quote unquote chronological order. If you go
There
back and
is, yeah.
forth. I wonder if that's
So there's some overlap between operations,
sure.
of course.
But I mean,
but
like,
you
I
can't-
bet you it's a far less bad decision than playing RE6 in chronological
Yes,
order.
because this game is actually fun.
There are portions that are not as fun, similar to RE6.
I had a blast holding my breath. What are you talking about?
Listen, Jim. Coming up soon, you're gonna have to be the ass doctor.
Oh no, that's right.
I don't want
have
to
to be
spoil it for
the ass
everyone.
doctor.
But it's
Okay.
not gonna be next time. Next time
We're
is
doing more of this.
Blazing Dark. Yo, 420
Hero,
Blazing.
420 Blazing Darkness.